clinical psychologist. I also am a diplomat of lifestyle medicine as well as a substance abuse counselor. Currently, my practice is in Hilo. I work in a primary care setting, which is why you see the background behind me that I work out of an exam room most of the time. And I am the behavioral health director for the Hawaii Island Family Medicine Residency. So I work with 18 family medicine residents to learn about behavioral health topics, and many of them get, we use my therapy dogs as part of their wellness strategy. So here is the PowerPoint for today. Again, there we go. All right, so we're going to talk about these types of service animals. So just briefly, and then we'll go through each one. Therapy animals are animals that are in service to other people, not their owners. Service animals are designed specifically for people with a formal disability, and we'll talk about what that specifically means and what animals qualify for that. And then there's emotional support animals, which is to help people in their housing. And there's a lot of confusion, and we tend to use these terms interchangeably, but they are actually specific designations. So therapy animal means one thing, service dog or horse means a specific thing, and an emotional support animal means a specific thing. So let's start with service animals, because that is the most formal of the animals we're talking about. And so service animals are animals that are trained to provide a particular task to someone with a disability. And service animals are regulated under the American Disabilities Act. Emotional support animals are not, and I'll talk about that in a couple of slides. So the American Disabilities Act only allows for dogs and miniature horses to be recognized as service animals. Originally it was dogs only, and then they added miniature horses in the last revision. And the miniature horses tend to be most helpful for people with mobility issues, are prone to falls and things, because the horse is able, the mini horses tend to be larger than most dogs and a little bit more sturdy. If someone says they have a service animal that is some species other than dog or horse, that is not recognized by the American Disability Act. So that is not an accurate statement. Service animal has to perform a specific task. Now, there are organizations that train service animals, like Guide Dog for the Blind, and some of the seizure dogs, or there's vet organizations that train dogs or horses to work with folks who are traumatized. And a service animal can be trained by the owner or by someone. It doesn't have to be a formal training program. It just has to be trained to perform a specific task. Is that to help them not dissociate while they're having a flashback because of their PTSD? Is that to help them to notice when their blood sugar is low or they're about to have a seizure, to check for allergens, right? Of course, dogs have a very high sense of smell, right? And so they are often used for people with peanut allergies or other food allergies, those kinds of things. It is a crime. So helping, yeah, I misread this last bullet point. Helping someone be safe because they live in a bad neighborhood or they're homeless and they might get violated, that in and of itself does not qualify for an American Disabilities Act designation as a service animal. So for protection is not enough. And here's a little video, and hopefully if the sound is not working, let me know, but we tested it and it should. This is a little 2-minute video about a mini horse.
Callie is one of a growing number of guide horses for the blind who assist people like Mona.
I'm working with Callie, she's working with me. We're sort of figuring each other out. Find the curb. Good girl.
Mona lost her eyesight when she was just a few months old, and as a practicing Muslim, one of her beliefs is that dogs should not be kept in the house.
Now, forward and find the dumpster. Go right. Good girl.
Unable to use a traditional guide dog, Mona had to rely on her family before Callie came into her life in 2008. Callie had been professionally trained, but there are a few natural attributes that make horses, big and small, such good companions. They can be trained to stay calm in even the most chaotic situations. Think police horses or even cavalry. They have a great memory, helpful when it comes to recalling dangerous situations and how to avoid them. Excellent vision is another trait that helps a horse lead the way. They can see in almost total darkness. Using such an unusual guide animal can attract attention.
And I'm sure people are annoyed about the horse. I'm sure, wherever you go, somebody's going to say, oh, well, you shouldn't have that horse here, and we really don't want it. She is a service animal, so really they can't deny you access.
But Callie has given Mona a new lease of life.
My whole world and my whole outlook on stuff has changed because I feel that there are more possibilities. Before Callie, I didn't feel like, that I could go places on my own.
All right, so then service animals, I had one more thought about. So I have a chart that we'll go through in a few slides that sort of goes through each of these designations so you can see a compare contrast. Service animals, because they are covered under the American Disabilities Act, are allowed to go everywhere with the individual as long as the person has them under control and they are not a threat. And I'll come back to that idea in a minute. So then moving on to emotional support animals, which this is probably the most misunderstood and sort of taken out of context part of the animals in service perspective. And so this is a really cute article if you want to look it up about different types of emotional support animals. But if we look at this, the paragraph that's there, I'm not going to read the whole thing, but it talks a little bit about how emotional support animals on airplanes really got out of hand. And so about 2 years ago, the federal Congress changed the law. So emotional support animals used to be in the Airline Carrier Act as being similar to a service animal, that they were allowed to travel for free with their owner when they had a letter from a mental health or a medical professional. Unfortunately, there were many cases, and you may have seen some of these in the news, where people had aggressive dogs on planes, where people had exotic animals like peacocks and pigs and other things that may actually be legitimate support animals. And so emotional support animals are not limited to a particular type of animal. Service dogs and service mini horses are the only designation. Emotional support animals that law doesn't have anything specific about what kind of animal, but because people were abusing it, and many people, it was suspected, were using it to take their animal for free on the airline instead of paying the fee, and to take them in the plane, and maybe they weren't well behaved, maybe they were aggressive, maybe they weren't potty trained. Because of all of those incidences, Congress stepped in and took emotional support animals out of the Air Carrier Act a couple of years ago. And so no longer is there an emotional support animal designation. And this, for some of our folks, has really impacted them flying inter-island. Now, animals can still travel on airlines, but they have to follow the rules and they have to be paid for. And so I haven't flown recently with my dog, so I don't know what the fees are, but often it's $50 or $75. And often the animals have to go in a carrier underneath the plane, which is not always fabulous. And my dogs are French bulldogs, and they're the brachycephalic breed, the smush-nose breed, and they actually don't do well under the plane. So we don't travel with them currently. But let's talk about when emotional support animals are allowed. Emotional support animals are regulated by the Fair Housing Act. So service animals are under the ADA. emotional support animals are under the Fair Housing Act, meaning they are only regulated for housing. So when people think, and this is very common, people think that their emotional support animal gets to go everywhere with them because they are supportive. And while I 100% agree that animals are supportive, there is no special privileges for these animals. So there are businesses that allow them. So I take my dogs a lot of places. Someone said they put their dogs in the stroller and take them. I have a double stroller. My Frenchies go with me. You can go to Home Depot. You can go to Target. You can take dogs into Starbucks most of the time. You can even take dogs into some Costco's if the manager allows it. And here in Kona, they do allow the dogs to come in, just not, they can't be in the cart. So many places allow animals, but not necessarily. And a lot of our beaches are not animal friendly, at least here on Big Island. And so just because you have an emotional support animal doesn't mean you get to take them everywhere. You only get to take them anywhere that a regular animal would be allowed. So emotional support animals, as defined by the Fair Housing Act, is any species which helps them function in their housing and that they have supported documentation. Emotional support animals are not service animals. If people qualify for both, the service animal is a better designation because that's under the ADA and that does give them access to take their animal everywhere. ESAs do not have to be trained to perform a specific task. They really are just there to help keep the person calm and soothe them and help them be more functional. The language from the Fair Housing Act is that individuals with disabilities must have a DSM-5 diagnosis, right? It's emotional support, so they have to have something. And if that person doesn't qualify for a major mental health diagnosis, but has medical issues, and then they have psychological problems related to their health issues, which is a DSM-5 diagnosis, you can diagnose the psychological issues related to their chronic health condition, and that having the animal helps them function and remember to take their meds and manage their anxiety and that kind of stuff. So they have to have a DSM-5 diagnosis, and that the animal helps them maintain their housing. If they don't get that, if the animal doesn't benefit them in that way, I mean, of course, all of us that are animal lovers, and not everyone is, our animals are very helpful to us. But really, if it's just nice to have the animal, no need. Now, the only time you really need an emotional support letter is if the person doesn't own their home. If they own their home, they're in charge of whether they have animals or not and what they do with their home. But if they're renting, if they're in a shelter, if they're going to be at a hotel, then having an emotional support letter can be helpful. Housing facilities must permit emotional support animals unless they can demonstrate that it creates an undue financial or administrative burden or would fundamentally alter the nature of the housing program. And so this is a high legal bar, and I'm not familiar with any housing setting that has successfully been able to bar emotional support animals. We will talk about fraud in the next slide or the slide after that. And so here are just some pictures I downloaded from the internet of service animals. Mostly this slide is all service animals. And service animals do many, many things for people. So let's talk a little bit about fraud, because unfortunately fraud is highly prevalent these days for both service and emotional support animals. After this talk, your phone may pop up with an ad, particularly when you're on Facebook or the Gram or one of those, or Twitter, you know, that you can get a certificate saying you have an emotional support animal. It may pop up with an ad for service animal vests. If you search that on Google, you will find there's these services that mental health professionals will give you a letter right now saying that you qualify for one of these two designations. It is highly unfortunate because that really minimizes the people who legitimately qualify, and it makes it more cumbersome for housing facilities and other places to deal with the emotional support and the service animals. So many states, California is sort of leading the way. I think Hawaii is starting to be really prohibitive about this because this is becoming such a problem, although, you know, in the hierarchy of things that they have to deal with, it's not consistently enforced. And of course, everyone's having financial issues, so them being able to enforce it is more problematic. But California's law says that you have to have an ongoing relationship with the individual, which is really helpful, the individual that you're writing the letter for, so that you, these online services that people get on, pay $200, which is really, you know, not great for our folks living in poverty. It's a lot of money for them to spend for a service. And people do not need any documentation for service animals. They do need documentation for emotional support animals. So if someone tells them they have to get a letter for the service animal, that's inaccurate. Service animals, because of the disability and because of the stigma associated with it and how folks with disabilities have been mistreated over the decades, there is very clear language in the ADA. The only two questions that can be asked from us as mental health professionals, from the doctors, from the people at the restaurants and the bars, the only two questions that can be asked is this animal required for disability? And what is the animal trained to do? You do not ask what the disability is. Do not ask them to prove it. Do not argue with them about that. I had a psychologist resident that I was supervising. I previously lived and worked in Portland, Oregon, and she had a patient that came into private practice that brought her dog. She did not think she had a disability, questioned the patient about the purpose of the animal and what was the disability. And she meant well by it, but she got sued, and her malpractice insurance had to pay out quite a large sum for violating the disabled patient's rights. So the only two questions is the animal required for disability, and what tasks have they been trained to do? If they say no, they have not been trained for disability, then you can ask them to leave. If they say yes, and then they answer the next question, this one helps me with my anxiety, it helps me with my trauma, it helps me with my blood sugar, then you have to allow them. If you don't get answers that you think are legitimate, I would check with your legal counsel. And if you're at an organization, let your quality improvement department take care of that. But be very careful not to ask people other questions. Okay, so I think that's what these next bullet points are. Don't ask them about the disability or ask for documentation. Okay, the second bullet here is helpful. That while they may be a service animal, if they are not under the person's control, if they are not house trained, so if they're potting where they shouldn't be, if they are being menacing or posing a threat, then they can be asked to leave. Now, one question that comes up is if you have a service animal and someone else is allergic in that space, what do you do? The person with the allergy needs to be separated, and so they both have rights. You cannot ask a service animal and their person to leave because someone has an allergy. You have to manage that and deal with both of them. So you can't for allergies, or if there's a fear of dogs, we have to be able to help both people manage whatever that situation is. So here's some examples of probably fraudulent service animals. There was a peacock on a plane, and maybe peacocks are helpful, right? I don't really understand how a snake would be a service or emotional support animal. There have been documentation of monkeys as service animals. They are quite smart. All right, so then what do we do as healthcare professionals, and mental health professionals and primary care doctors and other physicians? So we do not need to provide any documentation of the legitimacy of the disability or that the service dog or mini horse does something. We may provide documentation to help them qualify to get a service animal from Guide Dogs for the Blind or vets that are providing dogs to folks that are traumatized, or any of those organizations. But mostly as healthcare professionals, there's not a lot we need to do with service animals. The most likely thing that we may consider, and this is entirely up to you and the organization you may work for, is if you want to provide letters for emotional support animals. And this has become a little bit of a charged thing. One of the divisions for the American Psychological Association has advised against this. It's not a division I belong to, and I do write these letters in many cases, and I also say no sometimes, and we'll talk about that. One important thing, if you are writing emotional support letters, is that we are in no way evaluating the dog or the other, whatever the animal is. That is beyond my scope, and I do not want to get involved in that. So I document that the person has a DSM-5 diagnosis, and the other half of this slide is going to be an example of what my letter looks like. That they have a DSM-5 diagnosis and that the animal helps them function in housing. All right, so then you put that they have a diagnosis, but that they don't, we do not put in there what their diagnosis is, because that becomes part of their housing file. You never know who's going to see that. So here is what my letter says. Waiting for the, I've got to pop up. So the patient's name, and then it says is under the care of our facility, so in our primary care setting, or if it's, you know, under my care as a private practice clinician or something, if I do it in private practice. And I am familiar with her physical and mental health challenges and functioning. Her diagnosis appears in the DSM-5 and substantially limits several of her major life areas, which is the criteria for having a DSM-5 diagnosis, is that people may have issues, but if it's not impairing their life, then it doesn't qualify. It's not severe enough, it's not acute enough. In order to help alleviate these difficulties, I recommend that the patient have an emotional support animal live with her. And I don't even really say what the animal is. Is it a cat, is it a dog? It doesn't matter, because I'm not evaluating that particular animal. You could put that in there. And there was, when it was, we had the airlines, I did put the name of the animal and the species and the weight, because that helped the airlines figure that out. And that the emotional support animal helps assist the patient in functioning independently. This is something that I've added recently with the new laws, particularly in California and some of the states copying that this is not an evaluation of the animal's temperament or training, since that's beyond my scope. It's also not required in the Federal Housing Act. So, and I had some housing here require that, say that they wanted to know, was the animal neutered, what was their temperament? And I wrote them a letter and I said, in my experience and to my knowledge, you cannot require any of this information about the animal under the Federal Housing Act, under the Fair Housing Act. And then I've also added this in the last year to my letters, so that we discussed that there are incidents of fraud related to emotional support and service animals. And I highlighted the importance of not misusing this designation. And that I advised the patient that the emotional support animals are allowed in housing under the Fair Housing Act, but was informed that emotional support animals have no special rights or privileges in public or while traveling. And she was encouraged to ensure that her animal was not an inconvenience or raise safety concerns. And I feel like these last 3 bullets insulate me. So there have been some other mental health professionals that have felt very strongly that we should not be writing these letters. And I support you. If this is beyond your comfort zone and this is not something you want to get involved in, that is certainly within your scope of practice to do that. However, there are many people that legitimately qualify for emotional support animals. And if they are in my practice and I know them, I will write these letters. And I feel like if there is an issue with their animal getting out of control, with them misusing it, I have been very clear in my letter, which has also been copied in their chart, and I write it in the note for that session, that I counseled them against these things. And so therefore, it's not my responsibility. And like many things, we do not have control of what people do when they leave our offices. If they go get high, if they commit crimes, if they do other unsavory things, we don't have that kind of control. We never have. So I'll pause here to see if there's any comments or questions. And I see there's a little bit in the chat that I will see. If there's anything. Yes, so let's see. Ella says that someone was able to pay a $75 fee for their dog. So you can still travel with your animals. You just have to pay the fee, and depending on what the animal is and the size, they can ride in the cabin. And so usually it's 20, 25 pounds. They can ride in the cabin depending on the airline and where the flight is. Although most airlines have a limit of how many animals they will allow in the cabin. So it's best to make those reservations early. So losing the emotional support animals for travel doesn't mean animals can't travel. It just means they don't get to travel for free, and they don't always get to travel in the cabin. Let me see if there are other comments here that I need to respond to. I'm not the best at multitasking.
Okay, I can help you out here. Can everyone, is sound okay? And Dr. Kohn, is the sound back for you? Just chat. Let's see here. Okay, so we have a couple more comments. I don't know if you went over this one from Renata. If you have a patient under your care, I would expect as a provider that the patient's disability would be already known by the HCP.
Mm-hmm.
Okay, as a real estate broker, most tenants have to give their animal up due to excessive barking or disturbing other tenants. We always try to accommodate.
Right. Right. So if the animal is a problem, then housing can still do things about it, right? You know, you don't get to have a really aggressive emotional support animal that bites people, right? Or that destroys the apartment. That's not allowed. But they do have to make accommodations when possible.
Kailani said, can you repeat one more time that service animals don't need a letter certificate, but emotional support animals do, or something along those lines? Can you clarify?
Yes, that is correct. So because of the protections that folks with disabilities have, there is no specific documentation needed for service animals. So the only thing that you can talk about with a service animal is, what were my two questions? I always have to check what they are. Let me go back.
Do you have a disability, and what is your dog trained to do?
Yes. Yeah. Yeah. So you're not asking what the disability is. You're asking, do they have a disability, and what is the animal trained to do? And know that only dogs and mini horses are designated. So the ADA doesn't want, because we can't treat diverse people, we can't treat people of different ages, we can't treat people with disabilities differently. So we can't make them prove it, but we can ask those two questions. I do think that some of the regulations may change slightly because of the fraud and abuse that's happening. So service animals don't need any particular documentation. People just have to be able to answer those two questions. Emotional support animals do need a documented letter from a licensed mental health professional or a licensed medical provider documenting that they have a DSM-5 diagnosis and that helps them in housing. And then there was a question, how is it wrong to inquire about the disability of the patient? Because they can disclose their disability if they want to, but we cannot ask. And the restaurant owner cannot ask, and the librarian cannot ask, and the police officer cannot ask. It's protected by the American Disabilities Act. All you can ask is, do you have a disability, not what your disability is. Now, if that disability is visible, you know that, but plenty of people have invisible disabilities, and they have a right to not disclose that. Please review the landlord's responsibility to okay, so please review what a landlord's responsibility is to allow an emotional support animal in a rental. So my understanding, I should say, not a lawyer, is that housing has to allow someone with an emotional support letter from a licensed professional, from a licensed healthcare professional. They have to allow that animal in the housing unless it somehow causes, let me go back to my slide. They have to be able to prove this last one, or where did it go? There was one in here about, here, this last bullet on this slide. Housing facilities must demonstrate legally that it's somehow an undue financial or administrative burden or would change the fundamental nature of the housing problem. So that would be a lawyer would need to be consulted about that. Now, if the animal is aggressive, is destroying property, is not quiet and violating the peace, again, housing can pursue legal options, but that's true, if you had a human tenants with no animals that were doing any of those things, you would also be able to pursue evicting them. But emotional support letters apply to housing, and they have to be able to have. Okay,
We
let's
have
go. Go
We
ahead.
have a whole discussion here going on about, so you should say that it's a service animal because then you don't need any documentation, but then that's fraud, so that could get prosecuted. So what do you do if you ask the two questions and the animal is a large cat? You call them out, and I would say yes, because cats are not allowed.
Right. So then that you can objectively say the only thing that is the only two animals that are designated by the American Disabilities Act are dogs and mini horses. And then depending on where you are at, you refer it to your legal department. So we have here in our primary care setting have had patients that come in with animals that are clearly not service animals, even when they've been a dog. They are clearly not a service animal. Then we allow and then our legal department pursues that, and they know the ins and outs about how to make sure that that happens correctly. And that's where my scope ends. And that's what and you know, businesses out in the world, I think that they can then get their legal advisor involved. They can probably talk with the police about that. It's a really sticky wicket. If people behaved well and used it appropriately, it'd be fine, because there are clearly people with disabilities that need their animals. And in this day and age, there's a lot of people that are doing it not in a great way.
I'm so glad we're going to put this up on the web page, because I could just see myself going on my phone to the Echo web page to find out what I can and cannot say.
Right. And I have a little handout at the end that we'll go over, and then I'll share that so you have that little chart.
Excellent.
So those are important things to know. This is what I'm really passionate about. Service animals are in service of someone with a disability. They're trained for a specific task. Emotional support help people manage their housing. Both of those are in service to the owner or the parent. And then there are therapy animals. Therapy animals are in service to other people. And these pictures on the left are two of my 3 French bulldogs. They used to go to work with me when I was in Portland at my clinic, and I also taught at a university. And the bottom picture on the left is Chester during finals week with my psychology students, and they were getting ready. They either just had taken an exam or about to take an exam, and they were just mobbing him. So therapy animals belong to an individual, but they serve other people. And so, you know, there are dogs that are on kids units and cancer units, dogs that go to libraries, and therapy animals can be any animal. They are not covered by the American Disability Act or the Fair Housing Act. They have no extra rights or privileges. And so people will say, this is my therapy animal. Really, they probably mean emotional support animal. And there are organizations that certify therapy animal teams. With COVID and some of the small communities, it's really challenging. There is, I think, Paws of Aloha on Oahu used to do this, and then they closed up shop during the pandemic. There is an organization called Alliance of Therapy Dogs. They had one evaluator on the Big Island where I'm at. They have not, that person's not been doing evaluations in over 2 years. So there are some alternatives, but on the mainland, there's Pet Partners and some other organizations. So therapy animals are there to provide support and therapy to other people, just generally because animals are wonderful to most of us. Then there's a specific specialized type of animal therapy called animal-assisted therapy. And this is usually when one of us as a mental health professional are using an animal for a treatment, as a treatment modality. And so the goal of animal-assisted therapy is to improve the patient or client, I'm in a primary care setting, so we say patient, a patient or client social, emotional, or cognitive functioning. And there is lots of support in the literature that say animals can be useful for educational and motivational effectiveness of participants. There are lots of studies about how animals improve people's blood pressure, their hormone level, reduce their stress level. So there's lots of support out there for that. Animal-assisted therapy can be provided in a variety of settings. It can be group and individual. The two most common, not only, but the two most common types of animal-assisted therapy are canine, dog, and equine-assisted therapy. There's also, and I did this for a while, crisis response, animal-assisted therapy where, you know, during the lava flow here on Big Island, the therapy animals go out and we're in the shelters, right? During 9/11, there were a lot of animals that were processing 9/11, supporting survivors as well as first responders. That's a unique kind of thing, and it also can be really exhausting for the animals, so you have to be careful. So I won't necessarily read all these bullet points. Thinking about if you want to have a therapy animal in your practice, and my animals do come with me to the hospital and to my private practice, these are sort of the things that are typical of what the animal should do. And then there's a set of bullets on the other side of the screen in a second of what the handler needs to be able to do. And so therapy animals can be other things besides dogs and cats. So it could be rabbits, guinea pigs, lizards sometimes. They do have to be able to be house trained, no aggression. There are, for therapy dogs, they have to be able to do the 5 basic commands, if I remember correctly, of sit, stay, down, leave it, and come here. And that's in the test typically. They have to really like interactions with other people. And, you know, because if they're just tolerating it, it's not good for the animal. They also often need to be able to deal with noises and distractions. So they, if you go through the test, they're tested with crutches and wheelchairs, and maybe here in the hospital I work at, we test them in a room with ventilators in a hospital bed to see how they deal with that. And here's what the handler needs to be able to do is understand what is going on with the animal. When is the animal stressed? When are they tired? When do they get overstimulated? To be able to manage the animal, help people be appropriate with them, to be able to manage conversations with individuals and stay engaged with their animal, help people interact with the animal well, and not have a criminal background. So here's what a typical therapy animal evaluation would look like. Now, some of the organizations like Therapy Dogs, Alliance of Therapy Dogs, or Pet Partners, you have to go through an obstacle course. You have to be able to do the commands, have the noises, all of that stuff. And so that's sort of what's included here. And so this is often what someone goes through. And when people want to be a therapy animal team here at a hospital, they go through this. And then when they come for visits beyond that initial evaluation, these are the kinds of things we're looking at. And so it gives you a sense of what, if you want to do this, or if you are at an organization that is thinking about having therapy animals come in, these would be my recommendations. And then here we are at my facility. So on the left, we have Pearl. Her name is Eliza Pearl. She's a therapy dog. She has a little name badge there. And she comes in my stroller. She comes in every other Thursday to see patients that have requested animal-assisted therapy. And I have a treatment plan for each individual of why we're doing that, helping with anxiety, helping with frustration level, with emotional regulation, sometimes with fear of dogs. I have a patient with significant medical trauma, and coming to the hospital, which she needs to do regularly, is really hard for her. And so she comes in and we do some exposure work with Pearl. And then Chester is the middle Frenchie that I have. And we also come in to do a lot of staff wellness, particularly in our time of COVID. And so here we are on our ICU unit, and these are all of the nurses that we were visiting some evening that after they were having a hard time, and they loved him. All right, so let's go through this chart. And this is a chart that I can send in and that can be sent out on email. So this will help you sort of remember all the different things. So let's go through line by line.
Question. Let me
Yes.
just insert the question to make sure we get it. What is emotional regulation?
Emotional regulation is, well, it's a set of skills in DBT, but emotional regulation more globally is about regulating our emotions. So that may be where we work with anger management. It may be where we work with people who have strong emotions that they feel out of control. It's about managing their emotions.
Perfect, thanks.
Okay, good question. All right, so there's a column for each of the 4 categories that we've talked about. Service animals, only dog or many horses, trained for a specific act. The regulation that covers it is American Disabilities. They have access to go everywhere. They can be formally trained, but not necessarily. This next line I could have updated, but this would be Hilo Medical Center and rural health clinics, but medical facilities, if you just put medical facilities or healthcare offices on that column, and I'll change that when I share it. Service animals are allowed in those settings. They are allowed in restaurants. Special considerations. Here's the two key takeaways with service animals, and I have to look this up every time because I could never quite remember it. Is the animal required because of a disability? What task has the animal been trained to do? So then looking at this column, emotional support animal is any species covered by the Fair Housing Act, only for housing. Doesn't mean training, not allowed in healthcare facilities, lots of fraud. These ones do get a letter. So it says, well, many animals are supportive. They must have a mental health diagnosis. Then we have pet therapy. The pet therapy, animal assisted therapy are both people, the animal being in service to other people. No special access. Certification is an option, but not necessarily required, because here at Hilo, or really on Big Island, because we don't have an option to get certified locally, we accept a Canine Good Citizen and Community Canine Good Citizen certificate from the American Kennel Club, which requires a test. Can come into organizations as they're approved. These are important, that the patient has to give consent, can't get in the way of medical care, can be used for staff wellness. And then animal assisted therapy is usually on a treatment plan, and then there is documentation in the electronic health record. Any questions about the chart? Here, I'll stop here. Anything in the chat that I need to know about?
Not about the chart, but we do have a couple questions. Oh, the chat is getting so long, I can't get it all there. Can you recommend a clinician or agency on Oahu that could help with a patient who has a fear of dogs? No dog bites, just doesn't like dogs too much, is scared of them.
I'm not familiar with that specifically. I would look on, Psychology Today is the best resource for finding therapists, and I would look for exposure. Exposure is a treatment methodology, and other people on the Echo might have a recommendation. I just, I'm in small town Hilo.
Mm-hmm. Anybody have a recommendation? We will share this chart. Definitely. Mm-hmm. It'll be on the resource page on our Echo website. And Leimomi asks, when asking what tasks are they trained to do, if the person says medical alert, are you able to ask for specifics on what type of medical alert, or is this sufficient?
I would accept that. I mean, it's really complicated, and all of us are feeling frustrated about the abuse of service animals, but I would accept that and bounce that to legal counsel. If the dog or horse is well behaved and it seems to be in service, fine. If it's out of control, if it looks like the individual is abusing it, I would send it to, I'm at a hospital, so I would send it to my QI department for them to evaluate if that's a problem.
Great, that's all the chat.
Okay, so then just sort of, this kind of says the same thing about pet and animal therapy. This is Pearl, who is my youngest, and if I was at home, I would show her to you. I didn't bring her with me today. And this is our community health worker who loves her. And then the other side of the chart has this graphic on it, just to help you, just to boil it down to in a nutshell, right? So service dogs are there for the individual and their disability. Emotional support is housing only, and therapy dog is just for everyone else to enjoy it. If you fly through Denver, you might encounter any of these therapy animals. They actually have a team of 9 of them, and I love their little IDs. There are many places. I think DC has a therapy pig in the airport. I think Seattle has therapy animals. Many hospitals have therapy animals. Queens has quite a large contingent of therapy dogs that come to visit. And then the final slide I'll share with you before we just see what there is left to talk about is that I do have a small private practice. This is my Psychology Today website. So I'm happy to talk with people about emotional support animals, but I also am accepting other patients in my practice. It is telehealth only at this time. All right, so I got through everything. All right, let's see.
Well done.
Thanks. All right, so questions, comments, discussions from the group?
Lee says, when you say send it to QI or legal, is the person just waiting in the waiting room or lobby or outside until a determination?
No, usually, no, it's just like, we have this, because we provide ongoing care. So we just say, we just ask QI to review the case or for the legal counsel to get involved. Yeah, I would allow them. I mean, if you have to ask them to leave because it's a dangerous situation, but I would allow them to be there for the visit to the best of your ability. And then when you're done, because you're not going to get any, right? Lawyers don't respond the same way that an ER doc does, right? That's going to take a while.
They don't bill the same way either. Oh, sorry.
No, they do not. Good for them.
All right. Any other questions?
So people do feel really passionately about this. And of course, there's concern about our liability as mental health professionals. And so if this is beyond your comfort zone, it is completely reasonable. And it's actually probably more the norm for mental health professionals to say, I don't want to write these letters. And some organizations won't empower. So if you're employed somewhere, your organization may not empower you to write the letters. And that's fine. We all have to, we do the best we can, and we all have limited resources. And unfortunately, the people who've taken advantage of things have made this harder than it needs to be.
Other questions?
Annalisa, where are you at? Annalisa Pereira.
I think she's in Waianae.
Oh, Waianae. Well, actually, I have a friend who is in, my Hawaiian is not as good as it could be, in Makakilo. Is that right? Not far from, right? So she runs the Hawaii French Bulldog Rescue Network, and oh, you're with Dr. Nikki. I love Dr. Nikki, Wright. Yeah, maybe if I come to Oahu next time, I'll bring Pearl. But Jackie runs the Hawaii French Bulldog Rescue Network, and she has therapy Frenchies, and maybe she'll come visit you guys when she's a preschool teacher, and so when she's on summer break, maybe she'll come out there. I can connect you with her.
Excellent. All right, any other questions? So Annalise wants an email to get that information.
Okay, I think, I can share this again. Let me scroll down. So if you need me after today, here you go. So, and that's a patient-facing phone number, and then my email. So